Our next presenter is Tristan.
So I decided to do my presentation on COVID and how it affects the fetus. As you all know, past 2.5 years, we've been in the middle of a pandemic. Working in the healthcare field through nursing school, I found a lot of patients, and even my cousin who was pregnant at the time, asking questions about the effects of COVID on the fetus. Today, I'm going to present my research topic in pregnant women diagnosed with COVID-19. What is the effects of COVID-19 diagnosis on fetal outcomes? And I'll be going over 5 of my research articles and their findings. So what is COVID-19? Well, as Marcus said earlier, according to the CDC, COVID-19 is a disease caused by a virus called SARS-CoV-2. Most people have mild symptoms, but some can be critically ill. The CDC suggests that COVID spreads when an infected person breathes out droplets and particles that contain the virus. And then the infected particles can be breathed in by other people or land on surfaces, and from there be picked up. My research question is, as the title states, in pregnant women diagnosed with COVID-19, what is the effects of COVID-19 diagnosis on fetal outcomes? The population that I focused on was pregnant women, and the intervention was positive COVID-19. I didn't have a comparison, and then the outcome was the negative fetal outcomes. So my first research article included 388 pregnant women. The purpose of this article was to evaluate the association between maternal and pregnancy characteristics of adverse perinatal outcomes in COVID-positive pregnancies. The strengths of this article included that it was a university and community hospitals, and it is a World Association of Perinatal Medicine study. Some of the limitations that I found were the adverse perinatal outcome and overall population was low, which underpowered some of the evidence. And the study only included high and middle income countries, which potentially skewed the results. The relevance to this article, to my PICO question, was that the study answered my research question in correlation, which includes preterm births and cesarean deliveries as the highest percentage, which was 2 of the highest percentages that of the negative fetal outcomes. And then the second article that I'm going to discuss included 79 pregnancies, and the purpose was to report pregnancy and perinatal outcome of coronavirus spectrum infections. I'm just going to focus on the COVID-19 specifically. The strengths were that it was a systematic review with meta-analysis, and that all of the evidence obtained was recent. Some of the limitations were that the sample size was small, it had a non-randomized design, and some individuals may have been reported more than once. And the fourth limitation was that it was case reports and case series were used, making data susceptible to bias. And this article does answer my research question that negative fetal effects from COVID-19 also included preterm births, cesarean deliveries, and fetal distress. My third article, the sample size was 95 pregnant women with 51 neonates. The purpose was to determine the impact of COVID on pregnancy. The strengths of this article were that it was a systematic review with meta-analysis, and all evidence was also recent. Limitations of this study was that 7 of 8 studies were case reports and case series, and also it had a small sample size. This article did answer my PICO question and concludes that negative fetal effects included preterm birth, cesarean delivery, and fetal distress. In the fourth article that I have, the sample size was 11,078 pregnant women. The purpose was to look at risk factors of pregnant COVID-19 women and fetal outcomes and possible vertical transmission. The strengths of this article were that it did have a large sample size. It did have 2 study groups, which included COVID positive and COVID negative. And then the third strength was that multivariate logistic regression was used to compare the variables. The limitations of this study was the research design and the lack of evidence because the study only included research from Wuhan, China. This article did answer my research question and concluded that negative fetal outcomes included increased risk of preterm birth and cesarean deliveries. It did show that there was little evidence to support the maternal fetal vertical transmission. My 5th article included 90 pregnant women and 92 neonates. The purpose was to investigate maternal and neonatal outcomes of COVID-19 and possibility of vertical transmission. The strengths were that it was a systematic review with meta-analysis and that the data used was also recent. The limitations were that it included case series and letters that were written by the patients and sent in, and that it contained heterogeneity. And this research article answered my question that negative fetal outcomes in mothers with COVID-19 include preterm birth, fetal distress, and cesarean deliveries. Also, 4 neonates were COVID positive, although at the time this was rare. It still included that there were 4 neonates that did end up having COVID. So to conclude, I found that increased rate of preterm birth and cesarean delivery was consistent among all 5 of my articles. And fetal distress was consistent among 3 of the research articles. This is important to nursing and healthcare to create a stronger understanding to facilitate the best possible current and future outcomes and treatment plans for patients. Although there is lack of evidence to support the maternal fetal vertical transmission and more research needs to be conducted, I did find the other day when I was just kind of briefly looking things up and more research articles that the current research is now saying unvaccinated pregnant women who got COVID are much more likely to have stillborn infant or one that dies in the first 28 days. I also found that one of the articles said that unvaccinated pregnant women had a much more higher rate of dying and becoming hospitalized. And another thing that I found was most studies showed birth problems occurred in the 1st and 2nd trimesters. And then lastly, women who got COVID-19 while pregnant were more likely to have preterm birth, low birth weight, and stillbirths. Any questions?
So I'm intrigued by the percentage of C-sections. Most of those, I saw one of the slides from one of the articles had fetal distress being one of the main reasons.
Yeah, yeah, that's okay.
Was that the reason for most of the C-sections? Or was some of it also preterm? Did they really differentiate those?
They didn't really say much other than some of the mothers were like in the ICU, which kind of called for the C-sections.
Okay. I'm very interested in looking at more of this stuff over the summer when I have a little bit of time, because I think there's going to be a whole lot.
Yeah.
And some of the nurses in the units are talking about they feel like we're missing a key piece in all the research by not testing newborns for antibodies to see if any of those being transferred over and whether or not moms were vaccinated, have COVID-19, and do the babies are they born with antibodies in that first little bit? So anyway, I'm super excited.
Yeah.
I'm excited, but I mean, I think there's going to be a lot of interesting.
There were a lot more interesting pieces that I found just kind of looking over just current stuff, being that, this information that I found was last semester, but now they're saying that also mothers who are vaccinated and get pregnant, that the antibodies are showing up in the infant after being born and things like, so there's a lot more information now than there was. So I did find a lot of it interesting too. I did find a lot more stuff. I think as time goes on, there's going to be a lot more.
And it's interesting when you open up your, kind of like your scope, your window, where you're looking like, see stuff that happens at one hospital.
Right.
But you don't know what all has happened nationwide or
Right.
worldwide as far as the research.
Okay.